My Friends and Nurse presents The Birth Link with Nurse Colette. It's time to dive into amazing birth stories, expert interviews, and the most up-to-date medical research with me, Colette Wakalaker, a labor and delivery nurse with over 8 years experience. I'm also an OB certified specialist, cross-trained to postpartum and NICU, a lactation expert, and mom of 2 beautiful daughters. With a network of incredible medical friends and colleagues, we're here to help you navigate this often confusing and overwhelming birthing hospital system in the United States. My goal? To gain trust in birth and your body, provide valuable insights, and make this journey a little less daunting and a lot more joyful. Let's get started. What's up? Episode 2 of The Birth Link, everything APGAR scores and baby massage. This week I'm going to start the series on meeting your baby. Since, we're also meeting, I thought it was fitting. So all the things that are happening in that first hour, but really more specifically the first 10 to 30 minutes is really, really crucial. So I thought we can just dive into a series on that. So anything that I'm finding that I want to share related to those first 60 minutes in general, but specifically the first 10, I am going to be sharing with you. So this episode, I'm going to be discussing the history of the APGAR score. I'm sure you may have heard of it. It's the rating that we give your baby at 1 minute and 5 minutes and up to 20 minutes. We are able to quickly tell if your baby is transitioning well, if they're breathing okay, if they're having any issues with hypoxia. So that's hypoxia is, low oxygen levels and what it could mean to them during their first breaths and their first 10 minutes, 20 minutes. But, why did we start doing this? And is it needed after 90 years? It was created 90 years ago. So let's dive into why we started it and if it is really that useful and effective. Um, it may be a little bit of a hot take, but this will be evidence-based, and it's my opinion as well. All right. But first, I had the pleasure to interview and chat with Penny Hicks from Albuquerque, New Mexico, who owns an amazing company, Tyke Knit. That's Tyke, like Tyke, like a toy. Tyke Knit, Knit, one word. It's a company that supports families and caregivers in connecting with their babies as they grow and develop, specifically training in infant massage techniques. So super cool. We all want to give our little newborns massages, but why not do it in a really effective way, right? So she has been working as a pediatric physical therapist for over 30 years, and she's worked with babies, infants, and families through early intervention programs. So more so to prevent and if anything is wrong, to catch it early so that babies and the newborns can grow to their full potential. And that's what all we want, right? To set our babies and our kids up to exceed and excel and just be healthy and happy. So I loved talking to her. She gave me a lot of insights and also kind of, you know, chatted about what it's like to start a business. A lot of you guys may be starting a business or thinking about it. And I just started mine with my friend's a nurse, and she started Tyke Knit. And with 30 years of experience, you guys, in physical therapy. So she's just branching out on her own because she has so much to share. And it was really, really wonderful speaking with her. Before we dive in, a quick update on me and my friends and nurse and my life. What's going on is, oh geez, so much. One medical emergency after another. Like when it rains, it pours. Yeah, it's freaking pouring around here. I won't dive into like the details, but some stuff with my husband and my mom and, just taking care of the toddler. It's felt a little bit like I'm stuck in the middle and getting pulled all which ways, very thin, like I'm the net, right? But sometimes you're the net, and sometimes you're the acrobat that fell, right? You kind of you gotta be the support sometimes, for better or worse. Whether it's your mom or your kid or your husband, doesn't matter. But Fortunately, I'm 3 weeks into this detox. Okay, I'm doing this detox where I don't have no caffeine, sugar, dairy, gluten, or alcohol. So I don't know what your guys' diet is like right now while being pregnant. If you're pregnant, maybe you've cutting out some things. Definitely probably like some alcohol, less coffee, whatever may be, no more sandwiches or sushi. What are you doing? Read the book. If you haven't already, Expecting Better by Emily Oster. That saved me so I could keep drinking my coffee. But she just gives you the evidence and you make your own decision, right? I did a review and I posted on Instagram about that book. Very quick, very brief. But honestly, she's a data analyst and she just reviews the data behind everything that they tell you not to do and that's bad for you during pregnancy, and then lets you decide whether you want to do it. And she even gets to a lot of things at the beginning of your birth, like vitamin K and delayed cord clamping and cord blood banking, all that stuff. And we'll get into it too during these series. I have a lot to talk about when it comes to cord blood banking and delayed cord clamping, skin to skin right after birth, stimulating the baby. Should we put a hat on the baby? Oh my God, so many things. But, anyways, honestly, not drinking coffee or sugar or gluten, that may be the hardest, giving up my sourdough. Has, and alcohol too. I don't drink too much, but I'm sure I'd be drinking right now with the weeks I've been having. But I have been so clear-headed. I've been feeling healthy and energetic and really at a time that I feel like I have every reason to reach for some cookies or go to Starbucks or just go to fast food because I don't have the time, right? And then I wouldn't have the energy. Then I would like have a crash from the sugar or the junk food, and then I would feel lazy, and then I'd probably be depressed that I wasn't doing what I need to do. And none of that. I have had none of that. Thank God. I have been feeling great. I've had more energy than ever. I feel super clear headed and I'm really happy. I mean, this 30-day challenge is about to turn into 90 days, right? Especially as I gear up to get this podcast out and start promoting the Birth Ready Retreat, which is in August. And it's going to be 3 days, like a virtual birth clinic that I am so, so, so excited about. So stay tuned. I will go everything APGAR scores at the end of this episode. But first, here is my friend, Penny Hicks. All right. Hi, this is Colette with My Friends the Nurse and my first podcast. I'm so excited to have Penny Hicks here. She's a pediatric physical therapist. Hi, Penny.
Hi, Colette.
Hi. She has 38 years experience. She's from Albuquerque, New Mexico, and she specializes in infant early detection, infant and toddler care. I love it. This is really going to hit home with a lot of my audience. So I'm so excited to just jump into it and ask you some questions. First, tell us about yourself and this business of yours called Tyke Knits.
Thank you, Colette. It's wonderful to be here. I am launching a business and I'm in just the early stages of getting everything all put together. And what Tyke Knit is all about is supporting families of very young children, building that bond with their kids and learning to read their baby's cues and just supporting their overall development through practicing infant massage techniques with them. So what I'm wanting to do in my business is to help parents learn infant massage movements to address any concerns that they have with how things are going for their baby. This is a little, it's been a little side practice of mine, and I'm just wanting to put all my attention into that as I'm building this little business and community.
I love it. I wish I wish you started 2 years, 3 years ago. My little toddler, I can't get her to hold her down for any type of massage, but I'm sure how to massage my calves at least. But yeah, in the beginning, I know how it is for new parents. I've been there with the newborns and like all their little gas issues and they're crying. You're like, what's going on? and you want to, they tell you to massage, but they don't really tell you how. So
Right.
it's going to come in
Right.
so handy for all of the new parents, honestly, and
Thank
starting right at
you.
the newborn stage, starting before newborn, so they know what to prepare for, right? Really
Thank
preventative.
you. I sure hope so.
And so tell us more about your history. How did you start in physical therapy and that brought you here?
So I've been a physical therapist for a very long time, as you mentioned, and really my work with early intervention with babies and toddlers, I always call it my first love, and it's the truth because I did that work before I met my husband, and we've been married. Is it 34 years now? So it was something that really spoke to me early on, and it's a special field with therapy in that it's a lot about parent coaching from the get go. It's not necessarily about me going and doing physical therapy on a kid. It's about finding out what goals parents want to work on and then finding ways to support them to do that in their daily routines. And so the infant massage piece of it is a certificate that I have from the International Institute of Infant Massage. And a person doesn't need to be a physical therapist to be a certified trainer in infant massage. And so that's what my certificate is about. It's a certificate to be a trainer to help people learn, what they need to know to do safe and effective massage with their babies. And it really does go up through toddlers. It's hard to start on a toddler, but it can
I
happen.
know. I cannot. Rough.
I have to tell you that I hit probably two really big walls in the last 5 years of my career. Like I kept thinking, what is going to be the capstone of my career? Here I have been doing this all these years. When will I know that I'm in that position where it's the capstone of my career? What do I want that to look like
Like you're
as
like you're satisfied, like you got it, like you know what you're doing.
right, and that I will have done what I need to do, and then I can say, oh, I could retire. And I'm not feeling anywhere close to retirement even after all these years, but because there's just too much, there's more to do. Um, but the recent walls that I've run into had to do with exactly some of the things that we're learning with Greg Todd. I I left early intervention and went to work at the schools because I thought, why don't I work a school schedule? Why don't I try to make money in a condensed period of time as opposed to across the entire year? Maybe it's time for me to slow down a little bit. And then I found like the only way to really advance myself with that was to find school districts farther away from my house. And I worked to the point of exhaustion. And so I left a school job and I called it a sabbatical. I just like, I'm going to take a little time off and see what
I'll be
that looks
back.
like. And
Need a breath.
just taking a breath. And then recently I left another job with not the point of exhaustion, but they were making a shift from having their therapist be hired on staff to a new owner came in and they wanted to contract the therapist. And I've just been doing this too long to, it was more meaningful for me to work for the little non-for-profit company that owned the facility
Right.
where I was working, as
Right.
opposed to a rehab company coming, changing my employment to the rehab company. So there was all this shift happening, and I thought, another wall. What does that mean? And so I literally left that on August 4th, and then I got an email about Greg's infinite income systems approach, and I just thought I am all
From a
in.
friend or coworker that
It
invited
was from some of his students, the note ninjas.
the Note
You've heard
Ninjas.
the note ninjas.
Shout
Yeah.
out to Note Ninjas.
Yeah, shout out to those ladies. And so I was actually doing that work that I left. I was doing some work with adults thinking, okay, well, I've just burned myself out with these kids over and over again. Not burned out with the kids, but just burned out with trying to make it work.
Okay, you can say it.
I'm crawling on their floors.
Right. It's that bureaucracy and business behind it. Like I love to sing and I sang for a few years, but then it just sucked all the pleasure and passion out of it when you started talking about money and management and blah, blah, blah. I'm like, look, I
Yeah.
just want to sing. I just love what I do. And so I got out of there when I went into nursing.
Yeah.
I get it. Yeah. It's too
And
much.
so I I just felt like what I loved about the early intervention work was that connection with parents and supporting them in their daily in and outs with their kiddos. And I thought, well, how could I just mostly focus on that? And
Mm.
what would that look like? I had ideas about the virtual space beforehand, like what would training modules look like on a website, and what would so I've been toying around with that, like all that driving I was doing, I was thinking about things like that. So here I am trying to figure it out.
This is an amazing part of your journey. Like it's
Yeah,
like a visionary, like that's top tier right here, where you're just coming up with this brand new system and program. And are other off time, like are other people you found doing this sort of thing? I'm sure there's ones out there, but
there are, and in the beginning, and we can talk about this a little bit more, but in the beginning I was a
I'm
little shy
fascinated with the
about that.
business part of it.
Yeah, I know. There are, and there's some great people doing it. And I was so worried about like stepping on toes or trying like being viewed as like a newcomer in a field that's been existent. And so I'm working on being more confident about that.
That imposter syndrome, and I think everybody
Yeah,
has it. And
yeah,
I see that with like even perinatal coaches too. And once you start reaching out to them and talking to them, you realize they're just like you, and they were newbies once too, scared and trying to figure out a new program and how to do it and how it looks.
yeah,
And if you just imagine yourself in 5 years, who are you going to be? And just imagine that person. And
yeah,
you say you don't have the experience. You have some experience and so much value and knowledge. And I'd love to dive into that more about that knowledge, because otherwise I can talk about this business part all day. But let's talk about like three of the most valuable tips, or just three valuable tips, honestly, that you could give new parents with these new babies that can help them maybe along the way.
wow, okay. I think when I think about like three things to have right there with you is it's okay to slow down and notice. There's a lot going on, and you may have other kids in the house, and your dishes are piling up, and the dog needs to be let out. It can be chaos, but if you just take a minute to just say, "Oh, wow, look at where we're at right now. What does it feel like right now? What is my baby doing right now?" And it can be he's snorting or he's just grunting, but just stop and notice and breathe that in for a minute.
I
And
love that.
and yeah, yeah, just put it on pause sometimes.
If you
I
could
think
miss
another
something, you can miss those little signs and symptoms when you're just so absorbed with everything around you and the to-do list, and it's just never ending. And then you kind of miss it. My daughter had scoliosis, and she was telling me she was in pain. She was 14 years old before I finally
yeah,
realized, a single mom working three jobs. I was like, oh my gosh, you have scoliosis. I'm a nurse. And I was like, oh no, I missed it. So that is amazing advice, just to stop and take a minute to just really notice. I love that.
yeah, yeah. And that can look different for different people, but just find a way to, even if you set a timer on your phone, to just pause for a minute, whatever it takes for you to do that. And
Mhm.
then on the flip side of that, it's my second little tidbit is you have to be patient with yourself. You're not going to notice everything. And my stop and notice is more like just being able to like be in the moment,
Mhm.
but like realize that things are moving really fast, and there are times that you just aren't going to notice everything or know all the answers to everything, and you're going to make mistakes, and that's okay. And try to just be patient with yourself with that. And then I think the third really is, know your tribe, find out who you can talk to, find out if you have a way to be with other parents of kids of a similar age, or if you've got a family member or a friend's family member who has been through it, who can just be a sounding board for you. You may have lots of worries about your child's development, and there are ways to talk to people about that, and all of those things that are running through your mind, if you've got people to bounce ideas off of, feel safe to do that. Find someone safe to talk to about your concerns and your joys.
I love that. Yeah. And be someone you trust. Everybody and their sister has some advice to give you. Sometimes it's an influx of advice and information, usually
Yeah.
unwarranted. When you're a new mom, when you're pregnant, oh my gosh, like I get it. Thank you for all the advice. But to have a
Right.
trusted, team around you that you can go to, someone like you and someone like me, someone just maybe a really close aunt or mom or someone
Right.
just to say, hey, I've noticed this, is this normal? What do you think? It's just so valuable. And we kind of take it for granted sometimes, or we don't put it as a priority. And so that's really important. And I love that having grace with yourself too and forgiveness,
Yes.
because it does go by so fast and we just blink and it's like 3 months have gone by. We're like, what just happened? How did I even survive this? Much less did I notice, this something on the leg or whatnot. Oh my gosh.
Right.
Yeah, I love that. Perfect. Good. Thank you for that. Okay. How about tell me maybe the most painful lesson that you've learned during all these years? Do you have one maybe that we can learn from?
I, I thought of this last week. And this is going to be a little bit of a joke, and then I do have
I love
something that's not good.
most
So
painful. Not a joke.
this is so painful to me, and
Funny.
it's judgment free pain. But here we go. I think I've learned that the audience I'm trying to reach is probably on TikTok. That is so painful for me.
I'm sorry.
Yeah. But I can do it. I've done hard things before.
Yes. What a this is gonna keep you forever young, I swear. We just gotta keep in the new stuff.
That's
And,
right. This is going to make me old or make me young. I don't know
I
which.
tell my
But
daughter I'm on TikTok. She's like, oh, mom, it's not cool anymore.
Mom, my son was like, "Wait, you
What?
got a Discord and a Snapchat in the same week?" I'm like, "Yeah,
Did
I
he
do."
really? My daughter, I told my daughter about Discord and she's like, oh, I never heard of it. I'm like, oh, really? It's a new thing. All the kids
Well, it's whatever.
get with the program.
Funny. Anyway, so that's, it's okay. I'm going to get over that. But I think, like, I feel like this is like the most stunning lesson. I don't know if it's painful, except that maybe I've had to go through some things because I just didn't do it. But the lesson is you really just need to listen to your heart.
Mm.
And when I was driving 86 miles from my house to go to a school district, and I knew like I was swimming upstream and I was exhausted, and I knew it, and I kept going and I kept going, and I just, if I had stopped and listened to all that sort of planning that I was doing in my head about doing something more like what I'm doing now, I think I, I wouldn't have had as much pain as I had. I wouldn't have needed to take 3 months off to recover from the exhaustion. I
Yeah.
thought, and then I started thinking, am I sick? Yeah, and exhaustion is, you can be very sick from exhaustion. But
Um,
anyway, so, I think, if something is just sort of your heart is saying this and your heart is saying it again, and it's saying it in a lot of different ways, go ahead and find out, like, how do you make that come into play? Like, that just, Greg's 5-day challenge landed in my lap, but I could have poked around and started to find some things out sooner than later. And it's okay. I'm going to be moving forward and it's all going to be there. That's fine. But I think just knowing that you can listen to your heart and it's okay to do that.
yeah, you took that step. You listened
Yeah.
and Enough is enough. Yeah.
Yeah.
I love that. That's great. So I have a question coming directly from like my audience because I get it all the time. In labor and delivery, I take moms over to postpartum, or I, get flexed over and I'm working at postpartum unit. And these moms with their crying babies, every time that baby's crying, they think it's hungry. Oh, baby's hungry. And they're just exhausted because that baby just wants to suck, really. Or there's another issue. And even when they get home, the issue with gas is just so prevalent. Like these babies get gassy and they're usually laying flat or they're swaddled up. They can't move their legs around. So, what about some tips that maybe I can use myself to teach my clients and my moms in the hospitals and dads to help kind of relieve, this is very specific, but the gas, like
Yeah, it's so
ice
specific.
picks and squeezing to help get
Yeah,
it up, or
help push it out.
some they get them upright and they pat, but some moms like, no, I don't want to pat, I just want to rub. And we're like, oh, so I do you have any tips for getting that gas out?
Yeah, there are actual techniques for that in the infant massage training. And it's
Perfect.
such a good question because it kind of happens across the board, right? The baby's system is learning how to digest. Hello, that's pretty hard. That
Yeah.
is pretty hard.
Yeah.
And
My husband's
and
system doesn't really is working on.
so there's a series of movements that you can do, and it depends on the age of the baby and how the baby's responding. But I think the first thing to know is if the belly is very distended and hard, it's very sensitive. So any kind of massage techniques over a belly that's like that is can be painful for an infant. So you want to kind of stay away from that. And if it is distended and very hard, then check with your doc, right? Like you need to ask your provider to check that out and see if that is that gas or is something else going on, something going on medically. There can be a lot of different things. But the like a when you're talking about picking a baby up and patting and things like that, I think something that people don't do naturally that can really help to relieve the gas. And I have a little massage doll here. Can I pick her up
Yeah, let me see. Look at
so I
that.
can show you, Colette?
Yeah.
So with a newborn, most people don't hold their newborns like this, you know. So having they have the baby on the back and they're trying to move their
Yeah.
legs like
Yeah.
this, but giving the baby upright full support against your body
Facing out.
and then bringing the legs up
Oh, yeah.
can help. And you could even do little
Perfect.
bicycles here, and then you're
I'll
not
make some content with this so that everyone can see it. Yeah.
oh then you're not with this little baby. Maybe you don't want to touch the tummy, but you
Mhm.
can do some of this bicycle stuff. But the baby, the mama might be reclined a little bit in the bed or semi reclined, and just to have the baby facing out so the baby feels the full support of your body while you're doing this.
Excellent. I love that. That's
And then baby's digestion, our digestion too, the small intestine, but no, the large intestine, they're backwards, right? You think of it.
yeah, yeah.
The large intestine, after the food comes out of the tummy and goes through all those little nooks and crannies of the small intestine, the large intestine kind of starts here by the baby's right hip, like the lower abdomen by the right hip, and then it goes
Creasing
up
the tip. Yeah.
and across and down, like a upside down U shape.
Yeah.
So really just strokes that go in that direction. If the baby can tolerate strokes on their tummy, and you can do this with them on their back or in your arms even, just little, we call them rainbow strokes, starting down here by this hip and then coming across and down.
Rainbow strokes. Oh, I love that.
Yeah.
Perfect.
And some people think, actually, in my massage instructor course, we did I love you.
Oh,
I love you. And just coming down like that. It's very light touch. It's not tickly light touch, but not pressure, because this is all learning to digest.
Yeah.
And so the skin can be very sensitive, but you want to do enough pressure that the baby's not sort of being surprised by the touch. You don't want to tickle the baby. Just upside down U, starting at the right hip, at the baby's right hip. So it's clockwise if the baby's facing you.
That's great. Oh, I'm taking that with me, and
Great.
everyone's gonna learn this. And then I'm going to tell them where I learned it and how to
Nice.
do. Oh my gosh. Thank you
Really
so
nice.
much, Penny. I guess we'll wrap it up. I could talk to you all day,
Yeah,
honestly. This was such a
likewise.
pleasure. And there's just so
Thank
much
you for
information.
having me.
So I will post in the profile of the podcast where they can find you. What's your Instagram handle? Just real quick.
It's at Penny J. Hicks, DPT.
Perfect. Okay. So at least we have that. They can go find you, follow her, like her, all of that stuff. And then she'll send you information about her program, which I'm sure is going to
Thank
get
you.
awesome. And she's creating it right now just for you. Awesome. Thank you,
Right.
Penny. We'll talk
Thank you, Colette.
soon. Bye.
Bye.
All right, medical update time. Let's go for it. So, this one is our real first medical update, and it's going to be on the APGAR scoring system, a little behind the scenes history, and then my take, right? So, this episode is actually inspired from a recent episode of Creogs Over Coffee. It's actually number 250 if you want to take a look at it and listen in. But this podcast itself, the Creogs Over Coffee, was designed, but not limited to it. Just like this one isn't limited to pregnant women, right? If you're interested and curious, you got to get all the sides of the story. So the topic of 250 was about labor and why we do the things we do in labor. So, like specifically the labor curve and how doctors have come to manage it, like the why behind it. This curve, or like maybe you've heard of it as stages of labor, right? About the 3 stages, and then there's 2 phases in it. It was actually introduced by a doctor. It was an obstetrician named Emmanuel Friedman. So it's the Friedman's curve. And this was in the 50s at Columbia University. And I'll definitely dive into that topic at a later episode. But what I learned on this episode was it was here at Columbia that he met the anesthesiologist Virginia APGAR, right? We know that is APGAR score, right? It was here. It was her. It was Virginia APGAR. She's an anesthesiologist. In 1938, she was actually the director of the Division of Anesthesiology. So amazing. This was like when women couldn't even get into medical school, right? That's what they made sure to note. And she wasn't only the director, but she was a first professor at Columbia. So bravo, applause, love her. I hope there's a movie. So, anyways, it was here and that I learned she met Dr. Friedman. And so my attention shifted. I was all about her. Tell me more. I want to know the history. I knew a little bit of why she started the APGAR score, but I really didn't get into the nitty gritty of it. So I kind of love this episode. And then I went back and I think they had another episode in 2022. If you scroll, you'll learn more about it, the APGAR score system, but this was more on the history and it was really cool. Anyways, let me get into it. So she met Dr. Friedman here. It was like the 1940s that babies were being delivered like too small and too apneic. So that means they're not breathing well and they weren't able to survive, or they weren't able to do well in life. And this was due mainly to the common practice of giving huge amount of narcotics right before delivery or during labor to get through it. This is when epidurals were not common, and the only way to really manage the pain was narcotics, specifically morphine. It was a practice called twilight sleep. Sometimes you still hear about it, where you're kind of like half awake, half asleep, and they're basically drugging you, snowing you, in fact, is what we call it. And they were giving about 40 to 50 milligrams of morphine in one time, at one dose, and then multiple times just to get through labor. If that tells you how painful labor can be, there you go. So they're kind of knocking them out a little bit. But what happens is that it's a depressive agent. And when we give narcotics, when we give morphine, we are always looking at the respiration rates on mom because they start to slow down, and that's a big risk. So this does, when you're giving it through your IV, pass through the placenta and to the baby, which means that they're going to have the same effects, limiting their breathing abilities. That is not something you want to do right before delivery when that baby needs to open up its diaphragm and expand its lungs for the first time and take in breaths. We do not want to limit their ability in any way. And that's what we were doing. So she needed to know. So basically, as she was trying to gain more popularity for the epidural and the spinals, which was just being introduced, she needed to be able to prove that the morphine and was causing these respiratory issues, and that switching over to an epidural would actually result in better outcomes for the baby. At the time, there was no effective way for them to demonstrate this or prove that. So she came up with the popular and still used APGAR scoring system, right? So later, she was able to adjust that to an acronym. I don't know if it was her or probably like later on in the 60s, they kind of did a backronym, is what the podcast host called it, which I've never heard of. But basically, you have the acronym, but you're using the person's name. Does that make sense? Kind of cool. So, anyways, Dr. Abkar came up with this, and she was able to obviously easily prove through testing and that this was causing issues with the babies. They were able to save millions of babies throughout time, maybe to this day, using the scoring system and jump in earlier and earlier, right? But yeah, so that was kind of where they started moving into Dr. Friedman's story, because in order to prove then how epidurals and spinals affected labor, she needed to work with, or she wanted to work with Dr. Friedman and just see how then epidurals affected it. So then they moved in. I thought that was pretty cool. That's the history of it. She started working with Dr. Friedman, and the scoring system stayed in play, right? Let's dive in now that we know that cool history and story. And I hope they do make some episode or movie about it, about her and maybe Dr. Friedman and their relationship. I don't know what it was like. Sure, it was very professional. But let's get into the actual scoring system. And I'd love to give my takeaway, right? So this scoring system, the APGAR scoring system, is able to quickly assess if the baby is having any issues with breathing, and is we're able to help sooner, right? Um, Basically, the scoring system is 0 to 10 at 1 minute and then at 5 minutes. And then if the score remains under 7, it is continued at 5 minute intervals for 20 minutes. So that's how we use that scoring system to this day. But these days, though, we use a scoring system, but our resuscitation is so advanced. We use a neonatal resuscitative protocol. We are all trained in NRP, and it's so advanced and we're so efficient that we wouldn't even wait until that 1 minute mark if we see any issue, especially if we are able to assess beforehand how the mom and the baby specifically is doing during that second stage pushing. How is the baby being affected? What are the risks? Is there a risk of shoulder? Is the baby having decelerations or showing category 2 or even 3 tracings? And does the mom have a history of morphine or SSRIs or anything that would alert us to maybe have a NICU team and respiratory therapist there? They are there before delivery for the most part. And if they're not, they're there within a minute, and we are already on top of it by 30 seconds. We are pretty dang fast because we can see an issue very quickly. So we wouldn't even wait for the 1 minute, right? So because a baby may take some time to transition naturally, though, The first score at 1 minute doesn't really give us a good prognosis on how the baby will do, especially if it's low. So if you're getting a low score because they're blue, or they're not moving around or screaming, like that's all going to impact the score, but it doesn't necessarily mean at all, and it can't predict that the baby isn't going to do good at 5 minutes or even 10 minutes or in life. It actually is not really a good indicator of anything at all at this point in history. So we need to be aware of that, and we need to give that baby time if they're healthy with no risks and we don't notice anything tremendously off, like a 0 or under 4. We can, like, even at 30 seconds, because by 30 seconds we're moving them to the warmer if we notice it's a 0 to 4. That's just how we'd run. But we can pretty much eyeball it and give that baby a good minute without any, you know, heavy stimulation except for mom. Um, Mom should just have her hands on them. Maybe we dry the baby off just for temperature, but there's rubbing is not necessary in that first minute. Unless, of course, we know the history and the baby wasn't doing well to begin with. Honestly, it's the 5 minute score that is a better tell. So 7 to 10 would be reassuring, 4 to 6 is moderately abnormal, and under 4, abnormal, especially if the baby is term or a late preterm. So like 35 to 37 weeks, right? That's late preterm. 37 to 41, or it's term. If we move to resuscitation, so 30 seconds in, we're moving the baby, and we start resuscitating with a face mask and some oxygen and any suctioning, then that APGAR score is affected from that alone. So we don't even report them. There's no standard reporting system when it comes to the APGAR score when we actually do something, right? We can still take the APGAR score. It's more for just general curiosity, I suppose. But we're going to go to cord blood gases. We have the ability now to take cord blood from the baby and learn if it was affecting like the blood circulation system or just the respiratory system, or like how long was this going out, I'm going on, and then that will give us a better sign of the outcome for the baby long term, and then how we are going to treat them. The APGAR score does not. It really doesn't affect how we're going to treat the baby or do anything for the baby. It can be very subjective, like who is taking the score, what measures were being done anyways, was it affecting it? It just doesn't, even a low score doesn't predict the mortality or how bad it is, and it really cannot be used to diagnose. So honestly, most infants with low APGAR scores do not go on to develop neurological issues. So that is that, you guys, and we're still doing APGAR scores, but it's like very casual. We are at 1 minute checking the heart rate, and we're doing it even if we're resuscitating them right, just like a general idea, okay, well, their heart rate's 80, they're not moving around, we can quickly make a score. Once we get good at it, we can very quickly do it, but it's not going to change too many things, so we don't hold too much weight on those APGAR scores, and I hope you don't either, which is my take on that. So my take is we're not holding too much on these scores. Okay, it's a general subjective scoring system that we used in the 50s because we were snowing moms with morphine, and babies were just coming out limp and unable to breathe, and we needed help quickly and quicker. And we were able to use the scoring system to move towards epidurals and spinals, which was a lot more safer for the babies. And with that, we we didn't really need to use the APGAR system because now we had NRP and we were moving a lot more quickly when baby needed extra help. So why we're still using the APGAR scores, I guess we're just used to it. We're that's just how we've always done it, right? For the last 94 years, if you think about it. 92 years. I think it was 1952, if I saw when she created the scoring system, if I remember. But that's a long time. And I just don't want you to put too much weight on that APGAR score. That first test that your baby gets, that first grade that you may have heard about. There you go. Now you know. Check out Creox Over Coffee if you're interested in learning more. Reach out if you have any questions about it. I thought it was pretty cool, and I hope they do a movie on Dr. Virginia Apgar. I thought it was pretty cool. Okay. Again, if you want to find Penny Hicks, her Instagram is at Penny J Hicks DPT. That's Penny J Hicks HICKS DPT. Or you can find it in my show notes too. I'll put it there. Thank you so much, Penny, and I hope you enjoyed the everything on APGARs. You can find more information and the resources as well in the show notes. And have a wonderful week. Thank you for listening to My Friends the Nurse presents The Birth Link with Nurse Colette. We hope you enjoyed today's episode and found it super valuable. Before we go, a quick reminder, the information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please leave a review, and share it with your friends. Your support means so much and helps us reach more people and continue to bring you great content. Until next time, guys, stay healthy and stay informed.